Question 1. A 68-year-old client with a 45-pack-year smoking history is admitted with worsening shortness of breath. Assessment reveals a barrel-shaped chest, diminished breath sounds, prolonged expiration, and oxygen saturation of 89% on room air. The nurse reviews the client's history and notes that symptoms have progressively worsened over the last 10 years. Which assessment finding most strongly supports a diagnosis of COPD rather than asthma? A. Symptoms worsen after exposure to pollen. B. Airflow limitation is largely reversible with bronchodilators. C. Progressive dyspnea that has developed over many years. D. Symptoms occur mainly during nighttime hours. Answer. C. Progressive dyspnea that has developed over many years. Rationale. COPD typically develops gradually over years and is associated with chronic, progressive airflow limitation. Asthma often involves episodic symptoms that are usually reversible and triggered by allergens, exercise, or environmental factors. Question 2. A nurse is assessing two clients admitted to the respiratory unit. One has severe persistent asthma, and the other has advanced COPD. The nurse must identify a finding most consistent with asthma. Which finding should the nurse associate primarily with asthma? A. Long history of cigarette smoking. B. Significant reversibility after bronchodilator administration. C. Progressive destruction of alveolar walls. D. Chronic productive cough for several years. Answer. B. Significant reversibility after bronchodilator administration. Rationale. Asthma is characterized by reversible airway obstruction. COPD generally demonstrates only partial reversibility and often includes permanent structural lung changes. Question 3. A client arrives in the emergency department with wheezing and respiratory distress. The nurse reviews pulmonary function test results obtained during a previous admission. Which pulmonary function finding would be most indicative of asthma rather than COPD? A. Persistent airflow obstruction after bronchodilator therapy. B. FEV1 improvement greater than 12% after bronchodilator administration. C. Reduced diffusion capacity. D. Hyperinflation with air trapping despite treatment. Answer. B. FEV1 improvement greater than 12% after bronchodilator administration. Rationale. Significant improvement in FEV1 after bronchodilator use strongly supports asthma. COPD typically shows incomplete or limited reversibility. Question 4. A nurse is educating a newly diagnosed respiratory client. Which pathophysiologic explanation best differentiates asthma from COPD? A. Asthma causes permanent alveolar destruction. B. COPD results primarily from reversible bronchospasm. C. Asthma involves chronic airway inflammation leading to episodic narrowing. D. COPD occurs exclusively because of genetic abnormalities. Answer. C. Asthma involves chronic airway inflammation leading to episodic narrowing. Rationale. Asthma involves airway inflammation, hyperresponsiveness, and reversible bronchoconstriction. COPD involves chronic airflow limitation and structural lung changes. Question 5. A client presents with recurrent episodes of coughing, wheezing, and chest tightness that worsen during spring and improve between episodes. The nurse suspects asthma. Which additional finding would most support this suspicion? A. Symptoms completely unrelated to environmental triggers. B. Chronic sputum production for decades. C. Personal history of allergic rhinitis. D. Progressive exercise intolerance since middle age. Answer. C. Personal history of allergic rhinitis. Rationale. Asthma is commonly associated with allergic conditions such as allergic rhinitis, eczema, and environmental sensitivities. Question 6. A nurse is caring for a client with advanced COPD and another client experiencing an acute asthma exacerbation. Which clinical manifestation is more commonly associated with COPD? A. Symptoms beginning in childhood. B. Atopic disease. C. Persistent airflow limitation. D. Complete symptom resolution between episodes. Answer. C. Persistent airflow limitation. Rationale. COPD is characterized by chronic airflow limitation that persists despite therapy, whereas asthma symptoms may completely resolve between attacks. Question 7. A respiratory nurse is comparing arterial blood gas trends between clients with COPD and asthma. Which ABG pattern is most likely seen in advanced COPD? A. Chronic compensated respiratory acidosis. B. Persistent respiratory alkalosis. C. Metabolic alkalosis without compensation. D. Normal ABGs despite severe disease. Answer. A. Chronic compensated respiratory acidosis. Rationale. Advanced COPD often leads to chronic carbon dioxide retention, resulting in compensated respiratory acidosis. Question 8. A client asks why smoking is considered a major risk factor for COPD, but not necessarily for asthma. Which response by the nurse is most accurate? A. Smoking has no effect on asthma. B. COPD is strongly associated with long-term exposure to tobacco smoke and airway damage. C. Asthma only develops in non-smokers. D. Smoking improves airway responsiveness in asthma. Answer. B. COPD is strongly associated with long-term exposure to tobacco smoke and airway damage. Rationale. Long-term tobacco exposure is the leading risk factor for COPD and contributes to chronic inflammation and lung tissue destruction. Question 9. A nurse reviews chest assessment findings. Which finding is most suggestive of emphysema-predominant COPD? A. Inspiratory stridor. B. Barrel chest and hyperinflation. C. Tonsillar enlargement. D. Nasal polyps. Answer. B. Barrel chest and hyperinflation. Rationale. Emphysema leads to air trapping and lung hyperinflation, producing the classic barrel chest appearance. Question 10. A nurse is evaluating responses to treatment in 2 respiratory clients. Which outcome best indicates effective treatment of acute asthma? A. Permanent elimination of airflow obstruction. B. Complete reversal of wheezing and improved airflow. C. Resolution of emphysematous changes. D. Restoration of damaged alveolar walls. Answer. B. Complete reversal of wheezing and improved airflow. Rationale. Asthma treatment aims to reverse bronchoconstriction and restore normal airflow. Structural changes associated with COPD are generally irreversible. Question 11. A nurse is caring for a 24-year-old client admitted with an acute asthma exacerbation. The client reports sudden chest tightness after exposure to cat dander at a friend's home. Another client on the unit has COPD and reports worsening dyspnea over several months. The nurse is asked to identify the finding most characteristic of asthma. Which assessment finding most strongly supports asthma rather than COPD? A. Symptoms triggered by allergen exposure. B. History of smoking 1 pack per day for 40 years. C. Gradual worsening of dyspnea over decades. D. Hyperinflation visible on chest imaging. Answer. A. Symptoms triggered by allergen exposure. Rationale. Asthma symptoms are frequently triggered by allergens and environmental exposures. COPD symptoms usually progress gradually and are commonly linked to smoking history. Question 12. A nurse is reviewing pulmonary function test results for a client with chronic respiratory symptoms. Which finding is most consistent with COPD? A. Normal pulmonary function between episodes. B. Significant bronchodilator reversibility. C. Persistent reduction in FEV1/FVC ratio after bronchodilator administration. D. Airway obstruction occurring only during allergy season. Answer. C. Persistent reduction in FEV1/FVC ratio after bronchodilator administration. Rationale. COPD is characterized by persistent airflow limitation that does not fully normalize after bronchodilator treatment. Question 13. A client with a history of asthma suddenly develops severe respiratory distress. Assessment reveals inability to complete sentences, use of accessory muscles, and oxygen saturation of 88%. Which pathophysiologic process is primarily responsible for these symptoms? A. Irreversible alveolar destruction. B. Acute bronchoconstriction and airway inflammation. C. Pulmonary fibrosis. D. Loss of lung elasticity from smoking. Answer. B. Acute bronchoconstriction and airway inflammation. Rationale. Acute asthma exacerbations result from airway inflammation, mucus production, and bronchospasm causing airflow obstruction. Question 14. A nurse is comparing chest X-ray findings in asthma and COPD. Which radiographic finding would most likely be associated with COPD? A. Normal chest X-ray between attacks. B. Flattened diaphragm and lung hyperinflation. C. Temporary bronchial narrowing. D. Reversible airway edema. Answer: B. Flattened diaphragm and lung hyperinflation. Rationale: hyperinflation and diaphragmatic flattening are classic findings in emphysema and advanced COPD. Question 15. A nurse is educating a newly diagnosed asthma client. Which statement by the client indicates correct understanding of asthma? A. My airway narrowing is usually reversible. B. My disease will always worsen regardless of treatment. C. Smoking is the primary cause of my condition. D. My alveoli are permanently destroyed. Answer: A. My airway narrowing is usually reversible. Rationale: a hallmark of asthma is reversible airflow obstruction, particularly when appropriate medications are used. Question 16. A nurse is caring for a client diagnosed with chronic bronchitis. Which assessment finding is expected? A. Episodic wheezing only during exercise. B. Chronic productive cough occurring for months over consecutive years. C. Complete symptom resolution after bronchodilator therapy. D. Symptoms occurring exclusively during allergy exposure. Answer: B. Chronic productive cough occurring for months over consecutive years. Rationale: chronic bronchitis is defined by chronic productive cough occurring for at least 3 months in each of 2 consecutive years. Question 17. A client with severe COPD has an oxygen saturation of 87% on room air. The healthcare provider prescribes oxygen therapy. Why must oxygen administration be carefully monitored in some clients with advanced COPD? A. Oxygen increases airway inflammation. B. Oxygen causes immediate bronchospasm. C. Excessive oxygen may worsen carbon dioxide retention. D. Oxygen permanently damages alveoli. Answer: C. Excessive oxygen may worsen carbon dioxide retention. Rationale: some clients with advanced COPD rely partially on hypoxic drive. Excessive oxygen administration may contribute to worsening hypercapnia. Question 18. A nurse assesses a client experiencing status asthmaticus. Which finding requires immediate intervention? A. Expiratory wheezing. B. Productive cough. C. Diminished or absent breath sounds. D. Mild tachycardia. Answer: C. Diminished or absent breath sounds. Rationale: a silent chest indicates minimal air movement and severe airway obstruction, representing a life-threatening emergency. Question 19. A client has both asthma and COPD listed in the medical record. The nurse understands that one feature commonly associated with asthma is: A. Onset after decades of smoking. B. Fixed airflow limitation. C. Presence of eosinophilic airway inflammation. D. Progressive alveolar destruction. Answer: C. Presence of eosinophilic airway inflammation. Rationale: asthma commonly involves eosinophilic inflammation and airway hyperresponsiveness, unlike the predominantly neutrophilic inflammation often seen in COPD. Question 20. A nurse is teaching a group of nursing students about distinguishing COPD from asthma. Which client scenario is most suggestive of COPD? A. A 16-year-old with exercise-induced wheezing. B. A 28-year-old with seasonal allergies and episodic chest tightness. C. A 35-year-old with recurrent symptoms triggered by dust exposure. D. A 68-year-old former smoker with chronic dyspnea and persistent airflow limitation. Answer: D. A 68-year-old former smoker with chronic dyspnea and persistent airflow limitation. Rationale: COPD is strongly associated with older age, smoking history, and chronic irreversible airflow limitation. Question 21. A nurse is caring for 2 clients in a pulmonary step-down unit. One client has severe COPD with chronic carbon dioxide retention, while the other has moderate persistent asthma. During morning rounds, the nurse notes that both clients are experiencing increased shortness of breath. Which assessment finding would most strongly suggest worsening COPD rather than an asthma exacerbation? A. History of exposure to a known allergen several hours earlier. B. Increased sputum production accompanied by progressive dyspnea. C. Sudden onset of wheezing after exercise. D. Marked improvement after administration of a short-acting bronchodilator. Answer: B. increased sputum production accompanied by progressive dyspnea. Rationale: COPD exacerbations are commonly associated with increased sputum production, respiratory infections, and progressive worsening of dyspnea. Asthma symptoms are often triggered by allergens, exercise, or environmental irritants, and may improve rapidly with bronchodilator therapy. Question 22. A nurse reviews arterial blood gas results for a client with long-standing COPD. ABG results: pH 7.36, PaCO2 58 mm of mercury, HCO3 32 milliequivalent/L, PaO2 68 mm of mercury. How should the nurse interpret these findings? A. Acute respiratory acidosis. B. Chronic compensated respiratory acidosis. C. Metabolic alkalosis. D. Acute respiratory alkalosis. Answer: B. Chronic compensated respiratory acidosis. Rationale: elevated PaCO2 with elevated bicarbonate and near normal pH indicates chronic compensation. This is commonly seen in advanced COPD with chronic CO2 retention. Question 23. A client with severe asthma arrives in the emergency department. The nurse observes increased work of breathing, inability to lie flat, and audible wheezing. Which pathophysiologic change is primarily responsible for these symptoms? A. Permanent destruction of alveolar walls. B. Acute narrowing of bronchial smooth muscle with mucosal edema. C. Fibrotic stiffening of lung tissue. D. Pulmonary vascular obstruction. Answer: B. Acute narrowing of bronchial smooth muscle with mucosal edema. Rationale: acute asthma symptoms result from bronchospasm, airway inflammation, and mucosal edema, leading to reversible airway obstruction. Question 24. A nurse is evaluating chest assessment findings in a client with emphysema-predominant COPD. Which finding is most likely? A. Inspiratory crackles limited to allergy season. B. Increased anterior-posterior chest diameter. C. Complete normalization of lung sounds after bronchodilator use. D. Episodic symptoms with prolonged symptom-free periods. Answer: B. Increased anterior-posterior chest diameter. Rationale: chronic air trapping in emphysema causes hyperinflation and barrel chest formation, resulting in an increased anterior-posterior chest diameter. Question 25. A nurse is teaching a client newly diagnosed with asthma about disease management. Which statement by the client indicates a need for additional teaching? A. I should avoid known triggers whenever possible. B. My rescue inhaler is used for sudden symptoms. C. Once I feel better, I can stop all controller medications permanently. D. Inflammation plays an important role in my condition. Answer: C. Once I feel better, I can stop all controller medications permanently. Rationale: controller medications are prescribed to manage chronic airway inflammation and should not be discontinued without provider guidance. Question 26. A nurse is caring for a client with COPD who develops worsening hypoxemia. The healthcare provider prescribes supplemental oxygen. Which outcome is the priority indicator that oxygen therapy is effective? A. Increased appetite. B. Improved oxygen saturation and decreased work of breathing. C. Increased sputum production. D. Resolution of chronic lung damage. Answer: B. Improved oxygen saturation and decreased work of breathing. Rationale: the primary goal of oxygen therapy is to improve oxygenation and reduce respiratory distress. Structural lung damage cannot be reversed. Question 27. A client with severe asthma has received multiple bronchodilator treatments. The nurse notes that wheezing has suddenly disappeared, but the client appears exhausted and increasingly lethargic. What is the nurse's priority interpretation? A. Airway obstruction has completely resolved. B. The client is recovering normally. C. The absence of wheezing may indicate critically reduced airflow. D. Bronchodilator therapy has become fully effective. Answer: C. The absence of wheezing may indicate critically reduced airflow. Rationale: in severe asthma, disappearance of wheezing can indicate a silent chest, which is a life-threatening sign of minimal air movement and impending respiratory failure. Question 28. A nurse is comparing risk factors for asthma and COPD during a staff education session. Which factor is most strongly associated with COPD? A. Seasonal pollen sensitivity. B. Family history of eczema. C. Long-term cigarette smoking. D. Childhood allergic rhinitis. Answer. C. Long-term cigarette smoking. Rationale. Cigarette smoking is the most significant modifiable risk factor for COPD and contributes to chronic airway inflammation and lung destruction. Question 29. A nurse is reviewing laboratory and diagnostic findings. Which finding is more commonly associated with asthma than COPD? A. Persistent airflow limitation despite treatment. B. Significant eosinophilia and allergic triggers. C. Chronic hypercapnia. D. Reduced diffusion capacity from emphysema. Answer. B. Significant eosinophilia and allergic triggers. Rationale. Asthma frequently involves eosinophilic inflammation and allergic triggers, whereas COPD is more often associated with smoking-related airway damage. Question 30. A nurse is caring for a client with worsening respiratory distress. Assessment reveals respiratory rate of 34 per minute, accessory muscle use, oxygen saturation of 86%, and inability to speak in full sentences. Which finding would most strongly support an acute severe asthma exacerbation rather than stable COPD? A. Chronic productive cough for many years. B. Progressive dyspnea over decades. C. Rapid onset of symptoms following exposure to a trigger. D. Barrel chest and hyperinflation. Answer. C. Rapid onset of symptoms following exposure to a trigger. Rationale. Asthma exacerbations often occur suddenly after exposure to allergens, exercise, cold air, or irritants. COPD symptoms generally worsen more gradually. Question 31. A nurse is caring for a 72-year-old client with severe COPD who reports increasing fatigue and worsening dyspnea over the past several months. Physical assessment reveals pursed lip breathing, use of accessory muscles, and diminished breath sounds. The nurse compares these findings with those of a younger client admitted for an acute asthma exacerbation. Which assessment finding is most characteristic of COPD? A. Symptoms that completely resolve between episodes. B. Chronic airflow limitation with progressive worsening over time. C. Airway obstruction triggered primarily by allergens. D. Significant improvement in lung function immediately after bronchodilator therapy. Answer. B. Chronic airflow limitation with progressive worsening over time. Rationale. COPD is characterized by persistent, progressive airflow limitation that worsens over time. Asthma is typically episodic and often reversible. Question 32. A client presents to the emergency department with severe wheezing, chest tightness, and shortness of breath after exposure to freshly cut grass. The nurse suspects an acute asthma exacerbation. Which underlying mechanism is primarily responsible for this client's symptoms? A. Destruction of alveolar walls. B. Chronic mucus gland enlargement. C. Bronchial hyperresponsiveness causing airway narrowing. D. Permanent loss of elastic recoil. Answer. C. Bronchial hyperresponsiveness causing airway narrowing. Rationale. Asthma involves hyperresponsive airways that constrict excessively in response to triggers, leading to reversible airflow obstruction. Question 33. A nurse is reviewing arterial blood gas values of a client with advanced COPD. Which ABG pattern would the nurse most expect? A. pH 7.51, PaCO2, 28 mm of mercury, HCO3, 23 milliequivalent/L. B. pH 7.38, PaCO2, 60 mm of mercury, HCO3, 34 milliequivalent/L. C. pH 7.28, PaCO2, 30 mm of mercury, HCO3, 15 milliequivalent/L. D. pH 7.50, PaCO2, 38 mm of mercury, HCO3, 32 milliequivalent/L. Answer. B. pH 7.38, PaCO2, 60 mm of mercury, HCO3, 34 milliequivalent/L. Rationale. Chronic COPD commonly produces compensated respiratory acidosis characterized by elevated PaCO2, elevated bicarbonate, and near normal pH. Question 34. A client with asthma asks why corticosteroids are prescribed even when symptoms are absent. Which explanation by the nurse is most accurate? A. Corticosteroids permanently cure asthma. B. Corticosteroids reduce chronic airway inflammation and prevent exacerbations. C. Corticosteroids eliminate all allergic responses. D. Corticosteroids reverse emphysema. Answer. B. Corticosteroids reduce chronic airway inflammation and prevent exacerbations. Rationale: inhaled corticosteroids are controller medications that reduce airway inflammation and decrease the frequency and severity of asthma attacks. Question 35. A nurse is assessing a client with chronic bronchitis. Which finding is expected? A. Complete symptom resolution between episodes. B. Productive cough with excessive mucus production. C. Airflow obstruction that is fully reversible. D. Symptoms only after allergen exposure. Answer. B. Productive cough with excessive mucus production. Rationale: chronic bronchitis is characterized by excessive mucus production and a chronic productive cough due to hypertrophy of mucus-producing glands. Question 36. A nurse is monitoring a client receiving treatment for a severe asthma exacerbation. Which assessment finding indicates improvement? A. Increased accessory muscle use. B. Decreased peak expiratory flow rate. C. Improved breath sounds and increased peak flow measurements. D. Increasing fatigue and lethargy. Answer. C. Improved breath sounds and increased peak flow measurements. Rationale: increased peak flow values and improved air movement indicate that airway obstruction is resolving. Question 37. A client with emphysema asks why breathing out seems more difficult than breathing in. Which explanation by the nurse is most accurate? A. The airways become excessively rigid during exhalation. B. Loss of elastic recoil causes air trapping during exhalation. C. Pulmonary edema blocks inspiratory airflow. D. Diaphragmatic contractions stop during exhalation. Answer. B. Loss of elastic recoil causes air trapping during exhalation. Rationale: emphysema destroys alveolar walls and reduces elastic recoil, making it difficult to expel air and leading to air trapping. Question 38. A nurse is comparing oxygenation problems seen in asthma and COPD. Which finding is more commonly associated with advanced COPD? A. Normal oxygen levels between attacks. B. Persistent hypoxemia due to chronic lung damage. C. Trigger-induced airway narrowing with full recovery. D. Short-term wheezing following allergen exposure. Answer. B. Persistent hypoxemia due to chronic lung damage. Rationale: advanced COPD can result in chronic hypoxemia due to irreversible structural changes in the lungs. Question 39. A nurse is educating a group of nursing students about distinguishing asthma from COPD. Which client history most strongly suggests asthma? A. 70-year-old with a 50-pack year smoking history. B. Chronic productive cough for many years. C. Childhood episodes of wheezing associated with allergies. D. Progressive dyspnea that developed over decades. Answer. C. Childhood episodes of wheezing associated with allergies. Rationale: asthma frequently begins in childhood and is commonly associated with allergies and atopic conditions. Question 40. A client with severe respiratory distress is admitted to the emergency department. Assessment findings include inability to speak more than 1 or 2 words, respiratory rate of 38 per minute, accessory muscle use, and oxygen saturation of 84%. Which nursing action is the priority? A. Encourage oral fluid intake. B. Obtain a detailed smoking history. C. Initiate rapid assessment and prescribed emergency respiratory interventions. D. Schedule pulmonary function testing. Answer. C. Initiate rapid assessment and prescribed emergency respiratory interventions. Rationale: severe respiratory distress places the client at immediate risk for respiratory failure. Stabilization of airway, breathing, and oxygenation is the priority. Question 41. A nurse is caring for a client admitted with respiratory distress. The provider suspects either an acute asthma exacerbation or a COPD exacerbation. The nurse reviews the client's history and notes that the client is 27 years old, has eczema, allergic rhinitis, and intermittent wheezing that worsens during pollen season. Which diagnosis is most strongly supported by these findings? A. Chronic bronchitis. B. Emphysema. C. Asthma. D. Pulmonary fibrosis. Answer: C. Asthma. Rationale: asthma is strongly associated with atopic conditions such as eczema and allergic rhinitis. Symptoms are often episodic and triggered by allergens. Question 42. A client with severe COPD develops increasing fatigue, confusion, and somnolence. The nurse suspects worsening hypercapnia. Which assessment finding would further support this concern? A. PaCO2 of 65 mm of mercury. B. PaO2 of 95 mm of mercury. C. Respiratory alkalosis. D. Peak expiratory flow within expected range. Answer: A. PaCO2 of 65 mm of mercury. Rationale: elevated carbon dioxide levels are consistent with hypercapnia and can contribute to confusion, headache, and decreased level of consciousness. Question 43. A nurse is evaluating medication effectiveness in a client with asthma. Which outcome best indicates that prescribed bronchodilator therapy has been effective? A. Reduced FEV1. B. Improved airflow and decreased wheezing. C. Increased mucus plugging. D. Worsening accessory muscle use. Answer: B. Improved airflow and decreased wheezing. Rationale: bronchodilators relax bronchial smooth muscle, improving airflow and reducing symptoms of bronchospasm. Question 44. A client with advanced emphysema asks why weight loss commonly occurs in severe COPD. Which explanation by the nurse is most accurate? A. Lung disease directly prevents nutrient absorption. B. The increased work of breathing raises energy expenditure. C. COPD causes complete loss of appetite in all clients. D. Oxygen therapy accelerates metabolism. Answer: B. The increased work of breathing raises energy expenditure. Rationale: clients with severe COPD expend significant energy on breathing, increasing caloric requirements and contributing to weight loss. Question 45. A nurse is caring for a client experiencing status asthmaticus that has not responded to initial bronchodilator treatments. Which assessment finding requires the most immediate intervention? A. Heart rate of 112 per minute. B. Respiratory rate of 30 per minute. C. Absent breath sounds bilaterally. D. Anxiety regarding hospitalization. Answer: C. Absent breath sounds bilaterally. Rationale: absent breath sounds in severe asthma may indicate minimal air movement, silent chest, a sign of impending respiratory failure requiring immediate intervention. Question 46. A nurse reviews pulmonary function test results. Which finding is most consistent with COPD? A. Normal spirometry between attacks. B. Significant reversibility following bronchodilator use. C. Persistent reduction in FEV1/FVC ratio after bronchodilator administration. D. Airflow obstruction only during allergen exposure. Answer: C. Persistent reduction in FEV1/FVC ratio after bronchodilator administration. Rationale: persistent airflow obstruction despite bronchodilator therapy is a hallmark of COPD. Question 47. A client with asthma asks why peak flow monitoring is recommended at home. Which response by the nurse is most appropriate? A. Peak flow measurements help detect worsening airway obstruction before severe symptoms occur. B. Peak flow monitoring replaces all healthcare follow-up visits. C. Peak flow readings determine oxygen saturation levels. D. Peak flow monitoring measures carbon dioxide retention. Answer: A. Peak flow measurements help detect worsening airway obstruction before severe symptoms occur. Rationale: peak flow monitoring helps identify early declines in airway function, allowing timely intervention before severe exacerbations develop. Question 48. A nurse is teaching a group of clients about risk factors associated with COPD. Which client is at greatest risk? A. A 20-year-old with seasonal allergies. B. A 30-year-old with exercise-induced asthma. C. A 68-year-old with a 40-pack-year smoking history. D. A 25-year-old with eczema. Answer: C. A 68-year-old with a 40-pack-year smoking history. Rationale: cigarette smoking is the strongest risk factor for COPD and is closely associated with disease progression. Question 49. A nurse is assessing a client admitted with severe respiratory distress. The client has a known history of asthma, which finding suggests the client's condition is worsening despite treatment. A. Improved peak expiratory flow rate. B. Ability to speak in complete sentences. C. Increasing drowsiness and decreasing air movement. D. Decreased respiratory effort with improved oxygenation. Answer. C. Increasing drowsiness and decreasing air movement. Rationale: drowsiness and reduced air movement are late, ominous signs of respiratory failure and require immediate intervention. Question 50. A nurse is comparing hallmark characteristics of asthma and COPD during a multidisciplinary case review. Which statement accurately differentiates asthma from COPD? A. Asthma is characterized by largely reversible airflow obstruction, whereas COPD typically involves persistent airflow limitation. B. Asthma results from permanent alveolar destruction, whereas COPD is fully reversible. C. COPD is primarily triggered by allergens, whereas asthma is caused by smoking. D. COPD usually begins in childhood, whereas asthma develops later in life. Answer. A. Asthma is characterized by largely reversible airflow obstruction, whereas COPD typically involves persistent airflow limitation. Rationale: the key distinction is that asthma usually demonstrates reversible airway obstruction, while COPD involves chronic, progressive, and largely irreversible airflow limitation. Thanks for watching 50 Nclex, the most confusing COPD versus asthma, the most failed respiratory question. If this video helped you clearly distinguish COPD from asthma, make sure to like this video, subscribe to MCQs Master 101, turn on notifications so you never miss a new Nclex review. Share this video with a nursing student preparing for the Nclex. Remember this Nclex rule: asthma equals reversible airway obstruction. COPD equals progressive, persistent airflow limitation. When you see Nclex questions involving smoking history, allergies and triggers, pulmonary function tests, barrel chest, wheezing episodes, bronchodilator response, always ask yourself, is this reversible or persistent? That one question can help you eliminate distractors and choose the correct answer. Keep practicing, keep learning, keep thinking like an Nclex nurse. I'll see you in the next video on MCQs Master 101. Success on Nclex is not about memorizing more questions. It's about recognizing the pattern behind the question. Stay focused, stay confident, and keep mastering Nclex one question at a time.